si pe mi heni. I heni ke kamata ai programa o e hoani. Pa i rotonga ni foki o ku mea mai ai eki premia Tonga. Pe mai kau whawhe ke kamata ai programa kakohono launch o pepa whakahino hino ki he tauhi ko ia ngahi maki kaipipihi pe koe NCDs. Hei a koe programa ko ia ahoni e whakatau ki atu ia e Mrs. Losaline Fonua ka koe Finance Manager o e Tonga Health.
Whatapu ki he awhio ai o tua mafi ho tau lotolotonga. Tapu ki he hau o tu tonga king tupo wono ka mai whale o haa mohe o fo. Tapu ki he whawhalangilangi ono pol huakawa me iliku. Ka koe ek pale mia o tonga. Tapu ki he ek minista o mo ui Honorable Dr. Saya Piukala. Tapu atu ki he kau whafofonga e kakai ki he whalea lea o tonga. Tapu atu ki haa taula eki mo haa taki lotu. Pehe e whakatapu ke kau whafofonga o ngahi pule anga muli o tau kau whataha i he houani. Tapu atu whoki ki he kau tale ki tapule o ngahi pot ngaue o pule anga. Tapu atu ki he sea o puate pule o tonga mo i Lelei, elta i noke kupu, ka koe whitngo fuluwha e lia o siasi o sisu kalaisi o kau maoni oni i ngahi aho ki muini, kai umaa e toenga o kau me mipa poate. O ku atu whatapu makehe, ke ngai kau taha i kai whapule anga, pe he whoki ke ngai hoa ngā ue o tau kau whataha i he polo kalamani. Ka e tā mua mo oku e whainga maalie ko e ni ke whakatau kei atuai a e tau polo kalama. May the blessings of our Lord Almighty and His ever-presence among us, the King of Tonga, King Tupo VI, our guest of honor, Honorable Huakawa Meiliku, the Honorable Prime Minister of Tonga, the Minister of Health, Honorable Dr. Saya Piukala, Excellencies of the Diplomatic Corps, Her Excellency Rachel Moore, the Australian High Commissioner to Tonga, Commissioner of Police, Mr. Shane McLennan, Chairman and members of Tonga Health Promotion Foundation Board, Chief Executive Officers, non-government organizations, development partners, ladies and gentlemen, a warm greeting to you all. Please allow me to take you through our program for today. O kōkole a whainga maalie ko e ni, ke whakawhi e a Reverend William Polota, ko me mipa o ko mitwha whanua ke ngai whakotua I kai ke pipihi, ke kātaki o whakata e whakataha angani a ki hafua lotu. May I humbly ask Reverend William Polota, a member of the National NCD Committee, to start this program with an opening prayer.
Peke whaia tau lotu. Tau lotu e Sihova. Sihova hua wha homo tua talu mei mua I mua. Hei kai koe a Fiona, koe o Fio, o koe hanga o whai e whakatupu. O tua o e palahame Isaac e papeheke a se kopi. Whawtai lahi hoa koini, koe maulawe monu I e aho whakakoloa koini. Hei kai koe aho na e pau pia ke hoko. Mautou na kai pau se mau mo ui. Whatatai mo ui ke me a vai fu e whanong anga o mau iai. Whatata ke fise a kau. Whatata ke mau ne puri atu. Hei kai koe mau wāpe a moi mateu hanga taha. Ka pau ko hanga taha o tau ke mau whawhetai. Ia mō minit ko toa ko lawesi mo ui e kau vai. Whawhetai fo ke hoa. Hei kai koe koloia e tonga. Ke tonu e la a tonga. Whakala koe whia ne a whio tupo wono. Take o whai ko mau ki pure angani. Koe mau lotu ia. Sihova whamure mōre. Mo whina ngalo taha. Mea elere e pure anga ko tonga. Alo ofe tahine koe nina nas pau me popo o whai. Malo ke whalau maari e tamatu I perehake e ka o mai hau eke o mau ki pure angani. Tō kupa ki nau tolu he mea elere e a tonga. Malo ke whalau maari e eke pare mea tonga. Ona polo hua kawa me iriku. Whio mai si o tamau eke Sihova mo tō takanga. Tau lota ngai whatongia lahi e pure anga. tatake whanua o na ngalo ka minista e kabineti pōpōk whai ke kei tatake lau maari e awhiona. Whio mai hoa koe ni mau kau whataha mo me mipa whitungo fulu. Kau takiloto Tonga mau hanga atua inoke kupu si hova ngahi whatongia lahi o nau fuesia ke ngahi mea whalau maari e whanua. O mea ahene mo e kau whafofonga o ngahi pure anga muri, peke kau tareki tapure, kau whafofonga, me kau whaafe maalunga ko hinga ko whakakato ai whainga ke kamata. Peka no lons ai tohi whakahino hino, mo e palani ko ni whekau aki, mo ngahi mahaki o ki kai ke pipihi. Mau loto atu Jehova ai ngahi polklama, mo ngahi asenita. Na whai e whotu to ke ai mau loto ke tāpu aki pia meilangina, a whiho lau maari e tau kau whataha mo e awhiona. Mo ne ako na ke whai ke o kau ako ngā, ko kau mo e awhiona, ko lava anga i whatongia. Mā vai mo e awhiona, kai ke hame a lava. Ko mau loto e mo e mahu hake hoa ko en Jehova. Whamonu ia po ke tāpu aki, mau kore malo hini, sisu Christ pe ko alo, ka ko mau whakamui. Amen.
Whamalo ki he tangata ik whai whekau i he koloa o e lotu, ko ne whahoko ke kamata ake ai polo kalamani. O kou kole pe whainga maali e koe ni ke whakawhei e CEO e potu ngawe mo ui, Dr. Siale Akau Ola, ka koe sea e komiti whafonua ke ngai whakoutua i kai ke pipihi ke ne whahoko atu ai lea talitali. O ka hili e lea talitali, e whahoko atu e he haki whamatala no. Whekau aki pa mo palan whafonua ke no whasi mo ta o ta ofi ai ngahi whakoutua i kai ke pipihi, wanoa uataha ki he wanoa uanima, ai au iloa koe Tuiaki i Amanaki ke Tonga mo ui Lelei, e whahoko atu he CEO e kautaha Tonga mo ui Lelei, Mrs. Ofeina Whirimoihala, pea mo Mrs. Karen Fukafuka koe whaiwhalei ke ngai whakoutua i kai ke pipihi. We will now hear from the CEO of Ministry of Health, Dr. Siale Akau Ola, who is also the chairman of the National NCD Committee, to deliver the welcoming remarks. Following the welcoming remarks will be a brief presentation of the Tuiaki i Amanaki ki Hatonga mo Lelei, which will be delivered and presented by the CEO of Tonga Health, Mrs. Ofeina Whirimoihala, co-presenting with Mrs. Karen Fukafuka, our NCD advisor. Dr. Siale Akau Ola.
Whatape ki he o toa mafi, kune awhia taulo Tonga. Whatapuat ki he ki palemia, ono polo whakaba mei liku. Ko e whakawhakalangilangi e pongpong koen. Whatapuat ki minista mo ui. Ka mai High Commissioner Australia, on Excellency Rachel Moore. Pero kole pe ke hu whanga ngai whakatapu ka kato, hu os whai atu MC, ka tāke motuani ke whahaki i lea taritari. Whafofonga e atu e komiti, whakafonua ko ia ki hana toka ngai kina, o e ngai mahaki o kai ki pipihi. Uluaki pe ko whamalo atu ki he CEO e Tonga Health, o mai whainga maari. Ko e ngā ue koen kōlawa, tau whailonga e ahoni, hono luva, pe hono hopoki, o e tohi mahu inga koen. Pea ko kore pe ke o ngā pe le whakapritania, whaeke ki lea taritari. I take this opportunity to welcome all of you. Special welcome to the Honorable Prime Minister for your time to launch, together with the Minister of Health, this very important document we are here today to witness. Your times and dedicated to this period, it's much appreciated. I'm here on behalf of as a chairperson of the National NCD Committee. And I'd like also to acknowledge the presence here of the chairman of the Tonga Health Board, Elder Inoke Kupu, who is also a member of our committee. It's great to see you, Elder Kupu. And of course, Reverend William Polota, who said the opening prayer, is also a member. And I'd like to welcome the Police Commissioner. I know you haven't attended any of the meetings, but you are a member. So it's good to see you. Looking forward for your contribution in our next couple of meetings. Honourable Member of Parliament who is here, and and of course I see the representative of the CEO of WHO here, Dr. Jun Guo. Welcome, good to see you. And from Japan, Office of Japan Government, and of course Chief Secretary. And CEOs, we have CEOs who are members of the committee, CEO for Agriculture, Customs, very important people who are here. So I'd like to thank you for your presence and your contribution to this very important document. Honourable Prime Minister, this document, which is conveniently titled in Tongan, Tuiaki e Amanaki ki Tonga mo Lelei. In English, persevering together through the crisis to a healthier Tonga. And to me, personally, it's very significant because I think for years we have been battling NCD in Tonga. And one could say we are becoming battle weary. We have been tired of battling NCD. People are still dying. But I think as Polynesians, as Tongans, the spirit of using difficulty as a stepping stone for opportunities, I think that's the message today. We are here to remind ourselves that we came to these oceans ages ago as discoverers. We are here to re-energize ourselves, to look at these difficulties and recall what our forefathers used to do. So I think that's how I look at this, and I thank you all for your presence here, and look forward for us being invigorated as we move out of this today to the future, and trying to continue the battle against NCT. So again, welcome everyone. Again, your Honourable Prime Minister, welcome. And we do look forward for a joyful occasion today. Malo apit, tua whak.
Whatap ke a whio ai tol taha i o tua taulo Tonga. Whatap ke whawhalanglang o aho, ona polhua kawa miliku, ko paremia Tonga. Pia ko kole ke hufanga atu i he whatapu, ko kamata aki ai ahoni. Ka tā ke whakahoko atu ai ki presentation ai new national NCD strategy wanoa wata, wanoa wanima. E tok whai ai takai atu ai Tonga Health, ke ngahi motu, pe whoki Tongatapuni, ka ko kole ke whakahoko pe ai presentation ko e ni i he lea whakapitania. This strategy is a compilation of the Tonga National NCD Strategy 2021-2025, Tuiaki Amanaki, for a stronger and more integrated approach by all parts of society to address NCDs. We have a history of taking progressive action to tackle NCDs. In Tonga, in 2004, Tonga was the first Pacific Island country to launch a national NCD strategy. In 2007, Tonga was the first Pacific Island to set up a health promotion foundation. We also have 2010, Halafononga. The third national NCD strategy was launched in 2015, the National NCD Strategy 2015-20. The Tonga National NCD 2015-2020 was built on the expertise and knowledge of implementing partners while taking into account global guidelines to focus on good practice, feasible actions that address the whole population, but place a clear emphasis on young people and healthy start to life. Tonga continues to be in the grips of growing NCDs crisis. NCD continue to be the leading cause of mortality, morbidity, and disability in Tonga. Results from STEP surveys showed that the prevalence
of these diseases has increased significantly. Hypertension has increased. And if you look at the slide here, only the Topako, we have the green light. So with the STEP survey 2017, tobacco smoking was reduced. And all the others with the red arrows shows that we haven't improved. Fruit and vegetable consumption have decreased. Physical activity, we have more people with physical inactivity. That's why the arrow goes up. The primary NCD share 4 behavioral risk factors, namely unhealthy diet, physical inactivity, alcohol, and tobacco use, as well as overweight and obese. The 2017 STEP survey showed 69% of the population had at least 3 or more of the risk factors I've just mentioned, an increase from 57% in 2012. Despite implementing 3 consecutive national NCD strategies, progress made has not translated into noticeable impact. Change is needed. And there is a need to take a different approach, a systematic approach. The new strategy seeks to build on past success, as well as address gaps to improve coordination, stakeholder engagement, and ensuring effective implementation that is realistic and measurable in a systematic way. The essence of the Tuiaki strategy is a whole of government and whole of society effort, persevering together to build a better, healthier, and happier Tonga. This is a representation of the concept of the Tuiaki, pressing it together against the wind, harnessing the strength of working together, pulling together of resources, capacity, and capability. Previous halafononga provided a path to reducing NCDs in Tonga. However, evidence show that not everyone is walking on that path. We need to harness the strength of working and persevering together. We need to take a different approach in order to achieve our ultimate goal of everyone achieving good health. Togetherness is a multi-sectorial, whole of government, whole of society approach, where there is active collaborations and participation at partners at all levels, within and outside the health system, with ownership by all. Tonga can only navigate through NCD's crisis if everyone, every organization, government, non-government, churches, schools, and civil society in every community working together. NCD is not a technical challenge. It is an adaptive challenge. Unless truly engaged, there will be no active participation. And only through active participation, there is true ownership, which comes with empowerment. Ownership is vital if we are to change the framing around health. Health is not just the responsibility of health sector or the government, but also of workplaces, churches, schools, communities, families, and individuals. It is everyone's business, and this has to be literal and real instead of just a lip service. Empowerment can create the change needed, and at all levels. There has been a lot of good work, sometimes done in isolation, failed to be sustained, and others not showing impacts. It was evident that most led back to the system at work. This is why the Tuiaki strategy has taken a system-based approach instead of the traditional approach of concentrating on just the 4 main risk factors. By addressing gaps within the system, putting measures in place to support and strengthen what works, it allows to better integrate of programs and services, therefore collaboration, better utilization of resources, sustainability, and ultimately showing impact. Overview of the strategy. The vision, that one page there shows the overview of the strategy. The vision of the strategy is that for the people of Tonga are empowered to choose wellness and live long and healthy lives. And the goals, We have 5 key results area. 1, effective governance and leadership. 2, multi-sectorial stakeholder engagement. 3, health promotion and disease prevention. 4, health system strengthening. And 5, M&E surveillance and research. We have 6 guiding principles for implementations. And Karen will talk more about and elaborate more on the guiding principles. So I will now pass on to Karen, who will continue on the presentation. Malo.
Malo Fina. This is the overview of the NCD strategy. Ofina said that I will elaborate a little bit more on the guiding principles of the NCD strategy, and this is about a whole of government approach, equity. If you can go back to the previous slide, please, Paula. Yeah, that one there. Equity-based, the importance of making sure that everybody have access to healthcare services, and the healthcare services available to everyone, regardless of their belief, their gender, or their orientation or ability or age. It also recognizes the importance of the central role of government. This is a national document. Response to the government identifying NCDs as a priority, a national priority area for action. Multi-sectoral actions, it's important that everybody work together. This NCDs is more than just a health issue. It's everybody's issues. There are a lot of factors that are outside of, that influence what people eat, how people live, what people do, and their health outcomes that are outside the health sector. So it's important that we include everybody in this. The importance of taking a life course approach, the importance of starting developing healthy habits right from the beginning. There's a lot of evidence now to show that the impact, even from inside the mother's womb, taking a womb to tomb approach, starting early in making sure that the health of the infant and the mother is important, is addressed. Individuals and communities empowered through the family. Everybody, we all know somebody who's been affected by NCDs, like diabetes, heart diseases, or cancers. So if everybody's affected, with NCDs, and the importance of using evidence-based approaches and practices that have been developed, that are available out there. They just need to be adapted for Tonga. Malo Tala, we can go on now for the. This is the overview that Ofena had covered of the NCD strategy. Go on to the implementation plan, please. The time frame for the implementation of the NCD strategy is aligned to the National Strategic Development Framework, 2015 to 2025. So this plan is from 2021 to 2025. So it was originally planned to be a 5-year plan, but now it's a 4-year plan, in aligning it to what the government is doing. Implementation, of course, will focus on the gaps and capitalizing on strengths achieved from previous strategies. To arrest the current trajectory, as Ofena shared, most of the NCD risk profile of Tonga is heading in the wrong direction. We need to halt the rise of NCDs in Tonga, as well as bend that curve and reducing it. And improving the NCD profile of Tonga. All the actions and activities identified for implementation are organized under the 5 strategic result areas. And the implementation is flexible enough to allow for innovation activities, as long as the implemented activities demonstrate that the activities would produce the outputs that we want to see, and these outputs will contribute to the outcomes and the overall and to the overarching goal of making sure that our people are healthy, productive, and they live long lives. Governance. So I'm just going to briefly run through the key result areas and their focus and some of the key outputs that we expect to see from this. The first one is, of course, effective governance and leadership. This is so important in making sure that all our actions are a focus and cohesive. So strengthen the ownership and commitment of the National NCD Committee. And thank you to the members who are here. It's important that we do this together. And strengthening the ownership and commitment of the NCD Committee will help to enhance the members' performance, and strengthen the buy-in for a whole of government, whole of society approach. During the consultation process, it was found that the current framework that we have is sound. However, the commitment and the leadership need to be strengthened. So we're going to focus on that. This is so important that the governance and the leadership level is strengthened, because the National NCD Committee, this is the body tasked by the government to lead and drive the government's response to NCDs. Yeah, so the second key result areas is multi-sectoral engagement and partnership. This is so important to engage all our stakeholders at all levels and across all the sectors, whole of government, all the different ministries. And thank you that you are here to represent a lot of these key ministries. And agencies, whole of government, civil society, community groups, church leaders, women's groups, youth, and even and also the private sector. The private sector is so important to be part of this, and we have a private sector representative on the National NCD Committee. Yeah. As I mentioned earlier, there are so many factors outside the control of the health sector. So we need the support of all the other sectors across the government. The third one is around health promotion and disease prevention. This is about supporting health behavior change in key settings, such as schools and workplaces, churches, communities. These are health promoting actions that target the 4 key risk factors of unhealthy diet, physical inactivity, misuse of alcohol and tobacco smoking. These things need to be addressed in all of these key settings where people live, where people work, where people learn, and where people play. So it's important to address all of these things across all the different settings. Health promotion, prevention, and disease prevention also looks at creating healthy environments. These are things that address the legislations, fiscal measures, and things like that help to provide an environment where healthy choices are easy choices for people to make. Yeah. And also the other key thing around disease prevention is the importance of developing healthy behaviors early in life, the importance of taking a life course approach from the womb to the tomb, and address all of their needs to make sure that their exposure to NCD risk factors is minimized or address. The fourth one is around our health, strengthening our health system. Strengthening the health system is so vital to achieving universal health coverage and ensuring that health services are accessible and available to all. Health systems include individuals, is our health workforce, organizations, processes such as integration and coordination process, leadership, governance, monitoring and evaluation, providing the evidence that we need, policy development, direction, evidence-based practice, guidelines, resources allocation to address the population's health needs. Strengthening of the health systems refers to addressing all of these components, not just one or a little bit here, a little bit there. We need to look at the whole system as a whole. And we need to address all of these things and address the gaps. Integration is so important now, given the environment that we're in with COVID-19. COVID-19 has been shown to be strongly linked to NCDs. Evidence shows that people with compromised health status due to NCDs are at a greater risk during the COVID-19 pandemic. In particular, adults with excess weight are at a greater risk. And we know from the data that are available from the STEPS is that a lot of us are overweight or obese. So we need to do something about that because it puts all of us at risk for COVID-19. And the last one is last key result areas is around monitoring and evaluation and surveillance and research. Monitoring and evaluation has been an ongoing challenge with the implementation of the NCD strategies in Tonga. There's been limited data available. We're not very good at recording and reporting what we've been doing to demonstrate that what we've been doing has actually made a difference to our NCDs profile here in Tonga. So it's important that we strengthen this. And one of the key things that we're looking at in the NCD strategy is to establish a monitoring and evaluation task force in order to help with this data collection, data sharing, and all of these things, to provide the evidence to our policymakers to show that what we're doing actually makes a difference, or, to change things. Research is important, and we need to strengthen the local research capability here in Tonga to build a body of evidence that is specific and contextualized to Tonga. So that's very important. To do all of these things, we need to work together, and these are the implementing stakeholders that were identified during the consultation process. Our National NCD Committee to lead and to drive a lot of these actions. Tonga Health that was established by legislation in 2007, supported the implementation of the work together with the National NCD Committee under the MOU and the Cabinet, according to Cabinet Decision number 637. So these things are already in place. Yeah, we just need to strengthen them and to make sure that they function according to the purpose that what they were set up for. Another group is the technical experts, a fit-for-purpose technical working groups, and this is a pool of technical experts who have been members of the National NCD advisory committees, who provide the advice and support to Tonga Health and the National NCD Committee. This group will be repurposed for fit-for-purpose technical groups who will be called upon on a time-limited basis to work together and provide the much-needed technical expertise and advice to Tonga Health and to the National NCD committees. And of course, all the other implementers, the government ministries, local authorities, CSOs, churches, community groups, the MNE Task Force, regional development agencies. These are all our implementers and supporters, and it's so important that we all work together and know our part that we're playing. Because this is what we want to see, the success and change, as I mentioned earlier, to see a change in the direct trajectory of the NCD profile of Tonga, improving, bending it in the right direction, and halting the increase of NCDs. Success is evidenced by strong governance, cohesive and coordinating efforts of the implementers. So it's important that we work together within the system that has been established. I just want to briefly acknowledge all of these groups of people who have contributed to the development of our new NCD strategy and the approach that we're taking. I acknowledge the development team under the leadership of Dr. Vei Matoto. They've done an excellent job in the design of this strategy. Tonga Health and the Ministry of Health, who continued to work together in leading this work. All the individuals, the stakeholders, agencies for their input, guidance and insights they provide towards the development of this strategy. And the Government of Australia for funding the development of this strategy and the ongoing commitment and funding support towards its implementation. I just want to make a note that the Government of Australia have been supporting the implementation of the NCD strategies in previous years. So thank you very much to the Government of Australia. SPC for their technical support and with the editing and the printing of the new document. And of course, you noted the cover page of our NCD strategy. The artist is a local artist. He, Daniela Petelo, he was a representative for Tonga on the Wake Up Regional Project that focused on engaging youth against the fight against NCDs. So that's been really good to have them on board. So here it is, ladies and gentlemen. You will pick up a copy on your way out, and I hope that you will use this document. It is a living document. It's not perfect, but it is what we have, and we hope that we will all use it and see the change in the NCD profile for Tonga improve in the years to come. Malo.
Whamalo ki he lava ko ngā raki e tau polokalama, whamalo ki a Dr. Sialea Kauola, lea talitai Lelei na ne whahoko. E pēwhoki ki he whamatala, Lelei ne whahoko he CEO e Tonga Moimoi Lelei, e pēwhoki he NCD Advisor, whekauaki pa moi Tuiaki e Amanaki ki a Tonga Moimoi Lelei. As previously mentioned in the brief presentation, we are grateful to the Government of Australia through the Department of Foreign Affairs and Trade for funding the Tonga National Strategy, the development of the Tonga National Strategy. Having said that, we are honoured to have the presence of Her Excellency Rachel Moore, the Australian High Commissioner to Tonga, and would like to invite her to deliver a remark. Your Excellency.
Thank you very much for the opportunity to join you here today. I'm feeling very inspired hearing all of these speeches. My respect to you, Prime Minister Huakava Meliku. My respect to you, Minister of Health, Piokala. My respect to you, CEO Health. Thank you for all you do and the work you do closely with us. To the Chair of the Tonga Board, to members of the Diplomatic Corps, to Tonga Health, distinguished guests, and all of those who are gathered here with us today for this very important moment. I am delighted to deliver remarks on this milestone achievement, the launching of this important strategy, which is critical for mapping the pathway for non-communicable diseases prevention and reduction here in Tonga. I would like to extend my congratulations to the Minister of Health and to your ministry, to members of the Tonga Health Board, members of the National NCD Committee, and CEO and staff of the Tonga Health Promotion Foundation. I acknowledge the immense collaboration and effort that has occurred to bring this strategy into fruition, and I congratulate you on the commitment you have all undertaken to address NCDs in Tonga. As you've said, this is a complicated strategy. It's not a health strategy. It touches on all elements of all of our lives, as you say, from the cradle to the grave. The collaboration needed to deliver a strategy like this that everyone is behind is enormous, and I salute the efforts that you have put into that. Australia and Tonga have a long-standing partnership across a range of Tonga's development commitments. But we have partnered together against NCDs in the health sector for over a decade now. It matches beautifully with some of our other partnerships, like in sports, and our great love of food. We recognise that it's critical to support health system strengthening and health promotion activities to tackle NCDs, but also to provide support in that range of other areas. In the past, Australia has supported previous NCD strategies, and we are proud to have supported the development of this next 5-year strategy. My team and I are looking forward to continuing this partnership directly with Tonga Health, as well as supporting the Minister of Health and his ministry in addressing NCDs through effective interventions and promotions that reach and engage families and communities to benefit their own health and well-being. I'm proud to mention the successful visit last week of our Australian Foreign Minister, the Honourable Senator Penny Wong, and I'd like to take this opportunity to thank you, Prime Minister, and your government for hosting her. She has left very happy I mentioned to the minister, she said in the car, is all of the Pacific like this? And Ewan said, no, only Tonga. Amongst the high-level discussions, we reiterated Australia's support to Tonga's health sector. I emphasised her sentiments that this is a new chapter. We are going to do more, to listen more, and to continue centering people in our partnerships in the Pacific. I'm very pleased she was able to come here on, I think, day 12 of her tenure. I understand that behaviour change in the world of NCDs requires a critical understanding of the incentives and barriers to people pursuing healthy lifestyle habits, and I don't like to reflect on my last 24 hours in that space. We all need to make incremental improvements in our lives. We understand that the issue must be approached in a multi-sectoral and holistic manner, supporting not just the health sector and health systems, but communities, and listening to the role and working with families because of that critical role that they play. And I'm so pleased that this strategy takes that approach. I'm proud Australia has stood by Tonga through some very difficult times this year, from the eruption and tsunami to the COVID outbreak. We have provided support in terms of vaccines, clinical equipment, tests and medical supplies, but in parallel to this, we have not forgotten the statistics. We understand what is having the highest impact on health in Tonga, and we have not forgotten the long-term NCD challenges. We're very proud to continue to work with Tonga Health and the Ministry of Health on these challenges. The diverse nature of NCDs means we'll need to work closely across ministries and take that multi-sectoral approach that we heard about, and we will continue to listen across all of those sectors. I wish you all and Tonga Health all the best in the implementation phase of this strategy, and I look forward to being a part of Australia's support to you in terms of achieving the results that you are seeking. Maloa pito.
Thank you, Your Excellency, for the kind remarks you just delivered. We are looking forward to your government's continuous support as we continue to prevent and control the non-communicable diseases in Tonga. Ik paremia, kuia e lau fo au ku fotu yo ma ofisi, ya koe konga peia e mau feinga e whaai ai e toonga mo ui, longo mo ui. Koe hoko e tahataha e ema, mo hoko e tolupi ema e aho kotoa. O ku tuku kotoa e mau ngāwe, o whaataia e he CEO, kai whakahoko e mau whamalo sino, i haki miniti e hongo fulu. Pea kou kolepe whainga maali e koe ni, ke mau ki whakaari ali atuai, ai mau whamalo sino ko ia whakahoko. Heilo na ahoko ia ko whakai ai ke tek motolu, ke tau kau ngā kau whataha, i hongo taimi ko e ni, e aho ngā ue kotoa pe, ke whakahoko ai haki whamalo sino. Tonga Health staff will now do a demonstration of the office exercise that we always do at 11 a.m. and 3 p.m. every day. And with DEAR, where it is required to drop everything and read, at 11 a.m. and 3 p.m. every day, we drop everything and shake. So everyone is invited to stand up just where you are seated and join us. Tonga Health staff. Whamalo ke kaungawe ai CEO mo e tale kita poate o e CEO e Tonga mo i Lelei, li takami, i ono tataki ate kaungawe no whahoko ki whamalo i sino ko eni. E pare mia, o kia ipe whakakaukau ke maulawa utilize kotoa ngahi le tio mo i TV a tongani i he taimi ko ia, tātaha pia mo i tolu he aho kotoa, ko uhi ke whakaai e taha kotoa pe, ke drop everything and shake i he whai taimi ko ia. Ko e tawa o main ke konga mahu inga taha o tau polo kalama, ko fia whaika maalie ko e ni ke kole ke 8 minister o i mo ui, Dr. Saya Piukala, ke ne mea mai moa o Tuiaki, atu ai Tuiaki e Amanaki, ke Tonga mo i Lelei, ke eik paremia o Tonga, ke hoko ia, ko ha mea ngau e whafonua, ke ono whasii, o ta ofi, ai ngai whautua i kai ke pipihi. Malo. Ka hili pe ia ko hatapuaki ke tau whanongo ke eik pare mia o Tonga, ono polu hakawa mei liku, ke tō hakoloa o polo kalama. We are beyond blessed to hear from our guest of honor, Honorable Huakawa Meiliku. Malo.
Chief Secretary, make sure I don't have any meetings at 11 with this particular office. I don't want to run into, anyway, just, tamo e toa mafi, tapu ki e mi sa mo'i, tapu heni ka elta kupu, wau maa kau taklotu. Tapu ki he kau CEO, Police Commissioner, tamake he heni ki e High Commissioner Australia. Ka maa ki mo tolko toa peng mo whatataha mai i he pongpongini, ki he kātoanga mahu inga koini, i he whikawa koini mo NCT. Tupe mua ki o hokat mua ai whahoani i he rea whapapalangi. Distinguished guests, ladies and gentlemen, Tuiaki I Amanaki ki ha Tonga mo I Lelei, or persevering together through the crisis to a healthy Tonga. On January 2022, on the 15th of January, we faced a Hunga Tonga Hunga Hapai volcanic eruption and the subsequent tsunamis. The so-called dual baptism of fire and water for our new government. And that was day 17 of the new government. So day 12 for Senator Penny Wong to visit Tonga, and day 17 when we faced that volcanic eruption and the tsunamis. Then on the February 2022, we encountered lockdowns, restrictions, and separations due to the COVID-19's arrival on our shores, especially in our communities. And now in June, we are reminded that NCT crisis is far from over. And we are only at the halfway mark of the year. And only God knows what the rest of 2022 has in store for us. But we are here, we're still standing through the grace of God and through persevering together. I will not bore you with the statistics, and we have experts for that. And I'm sure we all know NCD is a crisis. Well, have been a crisis for a while. I also know every single one of us can relate to NCDs, whether it is your family, your homes, your neighborhood, your community, your church, or your workplace. None of us can deny the devastation and the loss attributable to NCT. When we talk of NCTs and Tonga, there are really just three categories. First one is those who are at risk of NCTs. They are our children, our young people, who are the future of Tonga. The second one is those of us who are living with NCTs, whether well or not. And finally, the third one is those who are directly or indirectly affected by NCTs, such as the children left behind when parents are lost to NCTs, skills and leadership abruptly ended by NCDs and so forth. The point is, we cannot avoid or ignore NCD. No one escaped its grasp and its far-reaching effect. Distinguished guests, ladies and gentlemen, yes, we have done a lot of good work. Along with support from donor partners such as Australia and stakeholders, a lot has been invested in fighting NCDs. We humbly acknowledge all those who have given so much for this cause. We have come this far, but there's still a long way ahead. If there's something to be learned moving forward, is that there is a need for, first, better coordination of our efforts, improve monitoring and evaluation of what works, and the empowerment of stakeholders and communities through inclusiveness and effective engagement, as previously presented. Distinguished guests, ladies and gentlemen, today it is my honor and privilege to launch the new National Non-Communicable Disease Strategy 2021-2025, Tuiaki I Amanaki ki Tonga Moimoi Lelei. I join others in congratulating Ministry of Health, Tonga Health Promotion Foundation, key stakeholders, our donors, and regional partners, the local strategy development team, and everyone who contributed to this important work. Malo ngawe. We thank the Government of Australia for their steadfast commitment and investment in Tonga's health system, especially around NCDs. We also thank partner agencies and organizations such as SPC and the WHO and others for their continuing support and still taking this journey with us. The most challenging part of any strategy when it comes to its implementation. May I remind us all that this strategy belongs to you and I. Its success is in your hands and mine. Unless there is collective commitment and investment from every Tongan, man, woman, and child, from donor partners, private businesses, churches, communities, NGOs, government, and leaders, we will continue to witness the unnecessary loss and huge costs due to NCDs. We cannot afford to wait another year, another month, another day. The time to act is now. And together, we can get through this NCD crisis. I wish you all the strength, grace, wisdom, patience, provisions, perseverance, and unity that with blessing and guidance of God, we can reach a Tonga that is empowered, where our people get to choose wellness and enjoy long and healthy lives. I would like to leave you with a thought and a hope shared by one who is living with NCD in our community. May it inspire us in all our efforts to change the narrative for our people and the future of Tonga. Tuiaki I Amanaki, I kunai o Moiaki pe atalaki. Whatawangi pe kawa eiki, I hono whahoko koe ni e ngau Lelei koe ni o whalahi atu.
O mau koloa ia e pale mia, i he koloa wha ofa, ko ke whainasia ki tautolu, i he houani. Pea mo poupou kakato ko whahoko he wheitu una, ki he ngau e mahu inga koe ni, ki he kakai o e whonua. Ko tawa o mai eni, ki he konga wha osi o polo kalama. Pea ko lea whakamalo, e whahoko atuia e he sea, o e poate pule o Tonga mo i Lelei, elta ino ke kupu. Pea o ka hili ia, te whawhei a Reverend William Polota, ke wha osi a whakatahangani a ki halotu. We have come to the final part of the program. I would like to ask Elder Inoke Kupu, the chairman of the Tonga Health Board of Directors, to deliver the vote of thanks. Following the vote of thanks, let me once again invite Reverend William Polota to conclude this program with a prayer. Malo opito.
Whamoremore atu e pare mia ko ngalo i rea fu lahe whamausino nei whai. Kau tau whawhetai ko tō pē, ki e tu e langi ne ala ofa mak tau tōru ko tō pē, o tau au si ai aho mau inga koe ni. Ja ko whakatapu atu ki ek pale mia o Tonga, Honorable Wakawa Miliku. Whakatapu atu ki ek minister mo ui Dr. Saya Mao Piukala, pa mai kau minister kabineti. My highest respect and regards to your excellencies, High Commissioner of Australia and High Commissioner of New Zealand and members of the Diplomatic Corps. Whakatapu atu ki e ho ek whawhawhonga kakai ka o mai me mipa e wharearea Tonga. Whakatapu ki haa whaiwhikau mo taura eiki. O whakatapu atu ki ske taipure mo e CEO o e Health, pa mai kau CEO ko toa pē o e ngai potu ngāwe ke ai pure anga. Ka whawhonga ngai potu ngāwe tae whakapure anga ko toa pē o mō mea hene a hon. Ka o mai kau me mipa e poa te, CEO mo e ngāwe, kau ngāwe ko toa ai Tonga Health. Ka kore ke hūwhanga i tala whakapapa ka kato e whonua, ka ata ki motuani ki whakahoko atu, ai ki whatongia ko endi. O ko whamalola hi atu ik pare mia o mea mai i a honi. E whungani aki ai koloa pe mo whekau, ko tau me whitu una ki e potu ngāwe. Ke whakoloa mo whailonga i aki a hono tuku atu e palani whawhanua ki hono taofi mo hono toka e kina e ngahi whakoutua i kai ke pipihi e wanoa wa taha ki wanoa wa nima. O honga au pito ki ek minister o mo ui mo potu ngāwe ho tataki pa mo pou ki ngāwe. Le whahauko ai ki mo ui Lelei ai kakai e whanua. O kawai whoki ho pou mālohi ki ngāwe o whahauko ki ono taofi mo no purei e ngahi whakoutua i kai ke pipihi. O whamalo atu ke ho ek minister pa me kautaki ko tope o whanua i ho mou kau mai pe mono poupoua o e programa e ahoni. Whamalo atu ki whaiwhekau i lotu Lelei nai whai, o ne whakakoloa i kau ngāwe, pe mo e potu ngāwe ke mau haivi ke hoko atu aki, o no ngāwe e palani ko whakotutu. Your Excellency, High Commissioner of Australia, and members of the Diplomatic Corps, I would like to extend our sincere gratitude for your presence here today and for the support you have provided to health prevention and control in Tonga for many years. I wish to convey our sincere thanks to Your Excellency Rachel Moore, the Australian High Commissioner and the Government of Australia, on behalf of the Ministry of Health, the National NCD Committee, and the Tonga Health Promotion Foundation for the financial support towards the design of the National NCT 2021 to 2025, along with your full support for the implementation of the National NCT strategy. I wish to thank the WHO and the SPC for technical assistance toward the design, and the SPC for printing of the materials. Tonga has been trying to fight NCDs for almost 20 years now, and it will continue for the next 10 years. The desired outcome in the Sustainable Development Goals is to reduce NCDs by 1/3 by year 2030. The challenges to this fight include 99% of the Tongan adult population at risk of NCDs. Many of our children are overweight. Levels of smoking continue to rise among young women, and more young people are taking up smoking. Turning the tide of NCDs is the hands of all Tongans. A concerted effort is required by all sectors of the economy to promote healthy lifestyles for our young people, so that we eat healthy food, exercise regularly, and quit smoking and drinking. Ko whamalo atu ki kau me mipa ko mit whawhonua hana toka e kina ngai whakoutua i kai ke pipihi. I ngāwe lahi, i ana whakoloa ke palani, pe tuku atu i a honi ki whanua. Whamalo atu ki kau taki ngai potu ngāwe pure anga, mo ngai ngāwe anga, i kai whakapure anga. I a mou whotu hanga i ngāwe whakapotu ngāwe pe, ko no pou i tō onga mo ui Lelei. Whamalot ke tim whalalaka me kau tau kei whawhonua o taki ai a tok ta veisinia matoto wahai. I maima havea tu tom na kao pe mo te Island O be whake whamalot ke me mipa ngai komit whare I wha ma Tonga mo ui Lelei ne mo whafufonga I mai e ngai sektor ke o tau nofo whakatonga. Pe he ke kautoke tā ma tau o whare mahak vai o la mo kau ngā ue a public health. O whamalot ke me mipa poate o Tonga Health CEO mo kau ngā ue I ono tataki mo whakotutu e ngā ue mahu inga koe ni. Pe he e whakamalo ke Mrs. Karen Fukafuka ko NCD advisor I tokoni ko tope. O ko whamalo foki ke Tonga ko tope o mea mai ke kātoanga e aho ni me he whitu upe I tongani pe moe ope. Pe aku mau whakawhi ko toki mautoro ke tau kau whakataha. Ono mo ui aki ai mo ui whahi ehi me ngai whakoutua o I kai ke pipihi. He oku Lelei e whahi ehi I he tali ke puke ke toku whaitoo. O taulo tua ke he tui o e langi, ke ne tataki ai palani mau inga ko e ni. Ke hoko a Tonga, ko whanua mo ui Lelei, hono kakai, lewa e malanga kau tatau atu. Ai ke tau whaase pe ai proklapa koe ni. A whaase pe a koe kresa tau eiko si sukalais ofa e o tua, whio he lau maare maani oni. Ke I he a whio he paremia, ka o mai hoi ki me mi pe kabineti, pia pe he ka ki mautolo no kātoa, o na hiri kai whai pe o taingata. Amen.
Pea koe la whakatoi ai whamawharanga tonu o wani me ancient Tonga. Ai ako no whahoko a no hopoki, pe kono launch o pepa whaina hino ke no tauhi o e ngahi mahaki I kai pipihi, pe koe NCDs ai au whatamu aki a Tuiaki I Amanaki ki a Tonga o kumo Lelei. Whawhunga te kau whawhatongia o wani, hiu tā minaneti, mara e lone, Wahi Samsoni Lama, Sharon Elone, ko me saki whamukioa, malopoto mo mea mai, ka mo mea.